Just a minute, sir.
Thanks for a nice introduction. Just now you heard our elder man talking on better sex. Suppose somebody is not having good sex or not able to do sex, then what to do? So that is the reality of today. We are aiming for better sex. We are aiming for people who can't do it. So it's exactly opposite I am talking to, but the same thing holds good. Ultimately, the same thing holds good for everyone. Now, this is myself, Dr. Sathyanarayana. I am a gynecologist, but I practice sex medicine, qualified sex medicine specialist and psychologist also. Now, today we learn what is the psychological basis of a sexual dysfunction, what are the psychological interventions for sexual dysfunctions, and who are the couples fit for sex therapy, and what is the concept and practice of sex therapy, and what is the techniques to adopt it for an isolated sexual dysfunction. So, the causes of sexual dysfunction can be an organic disease exclusively, nothing else, or it can be psychological, relational, and situational, and good number of instances is a combined one. But the psychological factor, most of the people get the effect of the sex failure, not the cause of the sex failure. Now, what are the psychological causes of the sexual dysfunctions? It can be a remote cause, that is, an intrinsic factor of themselves or a factor of developmental factors or personality disorders of the people. Or learned causes, how they are brought up, how their sexuality is brought up, what are the cultural values of the couple. Then there are a good number of immediate causes. Leave alone because of the shortage of time and a good number of things. In the learned causes, traumatic early childhood experiences are one of the common reasons today. And conditioning of the sex, that is, people who are conditioned to do sex, masturbation or sex in dingy areas or secret areas or severe punishment when they're spotted out doing masturbation, a young boy. These things, they make sexual dysfunctions. And conditioning is more common today. That is, people are conditioned to do masturbation with the help of a porno only. People are having erection only after getting a blowjob. This is very common in cases which I see in software employees. And it leads to avoidance. Body image concerns are one of the common reasons. Relationship issues are the common reasons. They are immediate reasons. The immediate reasons are they don't know what is sex. And more important is demand for the performance. Demand may not be from the partner. Demand is self-driven demand. They wanted to do more number of times, more stronger. And they demand themselves to do more number of people. This is the commonest cause, immediate cause. Excessive need to please the partner. They wanted to do it on the first night. And lacking sex confidence. The next one and most important is failure to communicate. But the last three are more important than the other ones in the management of psychotherapeutic sexual dysfunctions. Performance anxiety and spectatoring and loss of abandonment are the three ultimate portals that make a sexual dysfunction out of an ordinary event. Performance anxiety, the man approaches sex with a failed mind, or he anticipates a failure. He will be worrying over the consequence of the failure, not about the failure. And he will be more worried about what is going to happen if I can't do. That is creating more trouble. So an isolated sexual episode is made into a permanent sexual failure. A single failure is going to create multiple failures and chronic failures because of the performance anxiety. That is, he is approaching sex with a failed mind. Now, the other thing is, there is a spectatoring. When somebody is failed to do sex, the next time he is seeing his own sex, just like his own ghost in his movie. That is, he is imagining or he is evaluating his own erections. The next one is, when just now told, when you go to a temple, you leave the chappals outside, and your concentration is not on the Lord or the chappals. In the same way, at sex, people do the same thing. So then, what are the strategies for psychological interventions? Is the implicit model. That is, people give permission. They give permission to us, or we give permission to them to talk about their sexual needs or sexual necessities or sexual problems. That is enough. More than that is not needed. Limited information as per the problem. That is, somebody comes with a body image. Limited information, not full information of sex education. No, only limited information for his problem only. More than that is counterproductive. Then specific suggestions are given, like how to do masturbation, or how to do the techniques of squeeze technique, stop and start technique, or coital enablement technique. There are some specific techniques are adopted. The last one is intensive therapy. If you go into a clinical practice of sexology, I am not talking the theoretical practice, a clinical practitioner, 75% of the psychogenic sexual dysfunctions can be managed with the first two. The last two, specific suggestions, will be able to do with 20%. Only less than 5% of the people need intensive therapy. Sex therapy is one of the intensive therapies. Now, you can see, this is a nice picture. There is a bee who wanted to collect honey, but it is sitting over the petal, not aiming at the juicy area. This is what is happening in sexual dysfunction. And you can see the pale eyes of the bee. Now we have to reverse it, make it to point out at the honey area. Now, sex therapy, it is a science. It is the concept of sex therapy and the practice of sex therapy is a science, but it is an art more than the science. It has to be learned from a guru. And I am fortunate enough to learn sex therapy. I am a gynecologist, but I learned the sexual sex therapy from my teacher, Dr. Alla. So, very simple word, it has to be little artistic. I projected this slide. It is the pleasure of the bee to gather honey to the flower. For the pleasure of the flower to yield honey to the bee. But flower is the fountain of life for the bee. Bee is a messenger of love for the flower. And both for bee and flower, the giving and receiving of pleasure is a need and an ecstasy. So just to be a little artistic more than the science, I quoted this one. This is from Umar Khayyam. The last one, when there is disparity, there seem and then no more of thee and me. That is the essence of sex therapy. There was a door to which I found no key to the woman. There was a wheel past which I cannot see. Some little talk a while of me and thee. There seemed and then no more of thee and me. This is what is practiced in sex therapy. Now, we go into the concept of sex therapy. Earlier, around 3000 years ago, almost 2500, a tantra sex was there, which was practiced, and today's tantra is different. Tantra sex is different, but that was different. I don't know how to do it, but I read it. Tantra sex. It is so much difficult to practice. Nobody is there to teach me. Otherwise, I have to learn it. So, but Masters and Johnson about 60 years ago, they devised a technique wherein they made a hypothesis. Sexual dysfunctions may be having a deep-rooted cause, but it is the immediate causes that trigger a sexual dysfunction. So addressing the immediate sexual dysfunction, immediate causes of the sexual dysfunction relieves the problem. So this how to relieve this one by means of a specific exercise. This is the hypothesis they made. And then the basic principles of sex therapy are: sex is a natural function. It happens. Nobody can do sex. I repeat, nobody can do sex. It happens. If somebody wanted to do, they fail. Then the reason for failure is the same thing. And they are not allowing the nature to take its own course. And we are poking a finger. That is the common cause of sexual dysfunction, or immediate causes of sexual dysfunction. Then there is no unknown partner in a couple with sexual dysfunction. One may be having a problem, the other may be contributing a problem or suffering from the problem. So the marital unity, the client, it is not the man, it is not the woman, it is the marital unity, the client of the sexual dysfunction, it's client of sex therapy. So it is the immediate causes that initiate and maintain a sexual dysfunction. Intrapsychic factors may be there or may not be there. Sexual dysfunction is the result of a destruction of this one, not constructive destruction. So resolution of this destruction restores the thing. Or when you can't resolve, circumvent the immediate causes. When you can't face it, make a circular cure. These are the basic principles. Now, here and now, causes are addressed. What is obstructing today? Only that part is addressed. Remote causes are not addressed. Very rarely they are addressed. When there is an obstacle in treating, or when there is an obstacle, or when there is a failure in a particular point of sex therapy, then only you sideline to the basic psychotherapeutic techniques. Now, a river is in a spade. Boy is on one side, the other is on the other side, they can't beat it. So, we have to teach the people to swim, which is impossible. It takes so long time. Construct a bridge, the bridge of communication between the two. That is the solution. The water is flowing with a spade, but still, in spite of the underlying causes, we are managing the superficial causes only. So, the goal of treatment is relief from the problem. Not if the treatment starts with the problem and the therapy ends at the problem. It is not a cure. So, only for sex couples in a steady relationship, I underline. Till now, sex therapy is never for a single person. Some good number of people ask for sex therapy. No, it is not possible. It is a short interest, that is, Masters and Jansen's techniques are there, but afterwards, Helen Kaplan modified the basic with the same concept, modified the way they do, a little more patient-friendly or couple-friendly, not patient-friendly or doctor-friendly and couple-friendly. It is a single therapist, the couple visits her once in a week. Suppose there is a failure of therapy at a particular step, then analyze what is the reason failure. Then go for psychotherapy only for that instance. For all others, it is the same single course of events. Now, there are two steps of sex therapy. One is sensate focus, another is techniques for the individual sexual dysfunctions. Two separate paths are there. The first one is sensate focus. Sensate focus is a big term, but in fact it is so easy. It is focusing on sensations. So much of highlight was there on sensate focus, sensate. We will be quite worried about. Sensate focus is nothing but focusing on the sensations which you receive from your partner. That's all. So if you use that word, then a whole lot of people will be coming forward for sex therapy. If you like, what, sir? 1 minute. So then, the sensate focus can have two. That is non-genital pleasuring and genital pleasuring. These are the techniques to be adopted. This is the way, non-genital way. So, without spoiling the original one, this is from Helen Kaplan. How to do sensate focus. These are the ways to do. After sensate flow, it is non-genital pleasuring, and next comes genital pleasuring. The same thing is done with genital organs. First non-genital organs, then genital organs. Afterwards, sex therapy, two different. That is, for erectile dysfunction, it is the genital stimulation, then woman on the top entry, then vaginal containment, woman on the top and thrusting, man on the top entry and thrusting, man on the top sex with ejaculation. These are the steps of doing for erectile dysfunction. And now, sex therapy for other sexual dysfunction. For a premature ejaculation, it is addition of stop and start technique. For vaginismus, addition of systemic desensitization, slow vaginal dilatation. For an ejaculation, it is guided stimulation and a bridge maneuver. For a female sexual pain, mindfulness therapy. For female anorgasmia, directed masturbation and coital alignment techniques. That is the first steps are same. The next ones for erectile dysfunction and premature ejaculation are different. Now, this is somebody who wanted to know the basics of sex therapy. A new book is being released in the first week of October at CSCPA conference, authored by my teacher, Dr. Dega Narayan Reddy. I am the co-author. Earlier, last year, we published one book called Handbook of Sexual Medicine, that the copies are exhausted. Now you can see how people are interested to do. This pure medical and pure psychological textbook, not for the general public, for a general practitioner or for a newcomer. Thank you for a patient listening.
Thank you. Thank you. It was a beautiful presentation. I think it is one of the very important takeaway for the delegates to understand and the concept of sex therapy and then practice it as much as possible in your work, because this is the best compliment for you to take it and then do your work in the clinic. To continue, our Dr. Raj Brahmavat was talking about Kama Sutra. I would like to bring another treatise from the south. All of you are in Trichy, in Tamil Nadu, Thiruvalluvar. Thiruvalluvar, he wrote 1330 couplets, and all are classified into three parts: Arathapal, Purutpal, Kamathapal. Ara means dharma, Purut means artha, Kama means kama, as he has talked about it. Where he is talking about 250 couplets. And all the couplets, you will see that you will see Masters and Johnson techniques. You can relate it to any of these techniques in sex therapy. Either any of the techniques, say focus or non-verbal communication, selection, how to seduce the partner, how to communicate, how to understand the context of the partner over a period of time and gauge the the message, the sexual content in that. All these things, inevitable separation, pirivu, when the partner is separated, not because of fight or quarrel, inevitable. Many of them they used to go to war. So there is a separation. How to she's longing for the intimacy, if not sex. So all these things he's talking very beautifully, and then Dr. Reddy is bringing it along with the modern sex therapy in Masters and Johnson's and many other things. And I'm sure that many of you may have some couple of questions. We'll be very glad to address some of the questions that if you have any. Yes, anything?
Yes. Separate session on this Thiruvalluvar and
Thiruvalluvar. Kamathapan. Please have a session next conference only on Kamathapan.
As I told you, this is a primer for everyone.
Yeah.
First time in Trichy, because nobody talks about sex, so everyone wants it.
Yeah.
So we were looking for a series of sessions, and I'm so glad you brought this.
Okay.
Thank you, sir.
Any few words, sir?
Oh, very, very relevant topic. Thank you, sir, for bringing it in a very, elaborate way. And I really appreciate the shaft of the team for, bringing in this topic into the light. I think as psychotherapists, it has become more, every session we have a couple. Now we have to check with them on how their sex life is. That's become a criteria in the intake itself. So that much of a relevance it has, and I'm really happy that you brought this on focus. Thank you.
Thank you, sir. Thank you, ma'am.
Thank you.
I would request the chairperson to felicitate this. I request the speaker to felicit both of the chairpersons.